Hello, everyone. Let's start with something really important. Women deserve autonomy. Full stop. You deserve to make informed decisions about your body, your pregnancy, and your birth. So when doctors talk about free birth, which usually means giving birth without medical professionals present, it's not about taking choice away, it's about making sure that choice is truly informed. Let's walk through 6 key reasons doctors are raising concerns. One of the biggest reasons doctors raise concerns about free birth is because most birth emergencies are unpredictable. And I want to pause here because this part matters a lot. There's a common belief floating around that if you're healthy, if your pregnancy has been uncomplicated, if you've prepared your body, then serious complications won't happen. And I understand why that belief is comforting. Pregnancy is intense, birth is vulnerable, and our brains desperately want certainty. But medicine and history tell us something different. Some of the most dangerous complications in childbirth don't announce themselves ahead of time. They don't politely wait until you've decided you're ready. They can happen to someone who did everything right, had perfect labs, normal ultrasounds, and no warning signs at all. Take postpartum hemorrhage, for example. It's one of the leading causes of maternal death worldwide. It can happen even when the pregnancy and labor were completely uncomplicated. When it happens, blood loss can be rapid and severe. The treatment isn't just stay calm or trust the body. It's medications, IV access, blood products, sometimes surgery, and timing is everything. Minutes matter, or shoulder dystocia. This is when a baby's shoulder gets stuck after the head is delivered. It's rare, but when it happens, it's an emergency that requires specific maneuvers and training to prevent oxygen deprivation or nerve injury. You don't predict it reliably, you respond to it. Then there are things like uterine rupture, cord prolapse, sudden fetal distress, or amniotic fluid embolism, events that are uncommon, yes, but devastating when they occur. These aren't failures of the birthing person. They're not caused by fear or mindset. They're physiology and chance colliding in a very intense moment. Doctors worry about free birth because when no trained professional is present, the margin for error disappears. There's no one whose sole job is to recognize when something has shifted from normal to dangerous. There's no immediate access to life-saving interventions when seconds count. This doesn't mean birth is inherently unsafe. Most births go well, but safety isn't about what happens most of the time. It's about what happens when things don't go according to plan. Hospitals, midwives, and obstetric teams exist not because birth is broken, but because biology is unpredictable. And here's the part that often gets missed. Choosing medical support isn't choosing fear. It's choosing backup. It's acknowledging that even strong, informed, empowered women can face emergencies they did nothing to deserve and could not have prevented. Doctors aren't warning women about free birth because they think women's bodies are weak. They're warning women because they know how fast things can change and how much difference the right help at the right moment can make. Another reason doctors are warning women about free birth is the idea that being labeled low risk somehow guarantees safety. And I want to be really clear here because this is where a lot of well-intentioned conversations go off track. Low risk does not mean no risk. It never has, and it never will. Risk in pregnancy isn't a permanent label you earn at your first prenatal visit and keep forever. It's fluid. It changes as pregnancy progresses, as labor unfolds, and even after the baby is born. Someone can be low risk for 9 months and become high risk in minutes. That's not because anything was done wrong, it's because bodies are dynamic. For example, blood pressure can be completely normal throughout pregnancy and then spike during labor or immediately postpartum. That's how preeclampsia and eclampsia can appear seemingly out of nowhere. The first sign may be a seizure, a stroke, or organ failure. These are medical emergencies that require rapid diagnosis and treatment, not reassurance and patience. Infection is another area where risk shifts quickly. A long labor, prolonged rupture of membranes, or retained placental tissue can turn a normal birth into sepsis in a very short window of time. Early signs can be subtle, fever, rapid heart rate, just not feeling right. Recognizing those signs requires training, and treating them requires access to medications and monitoring that simply aren't available in a free birth setting. Doctors also worry because free birth removes continuous reassessment. In medical care, risk isn't something we decide once. It's something we constantly reevaluate. Fetal heart tones change, bleeding changes, pain patterns change, progress changes. Those changes guide decisions in real time, and without someone trained to interpret them, critical warning signs can be missed. There's also a psychological component to this. When someone believes they are low risk, there can be pressure to stay in that category at all costs. Pain is dismissed, symptoms are minimized, concerns are reframed as fear or lack of trust in the body. That mindset can delay help when help is needed most. This is especially troubling because when outcomes are bad, the blame often shifts back onto the birthing person. They're told they didn't prepare enough, didn't believe strongly enough, didn't surrender enough. That's not medicine. That's not evidence. And it's not fair. Doctors aren't warning women because they think low-risk people can't give birth safely. They're warning women because risk is not a promise, it's a snapshot. And snapshots don't capture what happens when labor stretches on, when bleeding increases, or when a baby stops tolerating contractions. Support during birth isn't about assuming something will go wrong. It's about being prepared if it does. It's about having someone there whose job is not ideology, not aesthetics, not social media narratives, but safety. Low risk is a starting point, not a guarantee, and doctors speak up about that because they've seen firsthand how quickly the story can change. Another reason doctors are warning women about free birth is because newborns can decline very quickly, often in ways that are not obvious at first. Birth doesn't end when the baby is born. In many ways, that's when the most delicate transition begins. Inside the womb, a baby's lungs aren't doing the work of breathing, their circulation functions differently, and oxygen is delivered through the placenta. The moment a baby is born, all of that has to change, immediately. Most babies make that transition beautifully, some don't. And the difference between those two outcomes can be measured in seconds. When a newborn struggles, it may not look dramatic. It can be subtle. Poor tone, shallow breathing, a heart rate that's just a little too slow, skin color that isn't quite right. These are things trained professionals are taught to recognize instantly, often before parents realize anything is wrong. Neonatal resuscitation isn't about panic. It's about pattern recognition, muscle memory, and practiced response. Oxygen deprivation is one of the biggest concerns. Even short periods without adequate oxygen can lead to brain injury. In some cases, the signs aren't obvious right away. A baby may appear sleepy, quiet, or peaceful, when in reality, they are struggling to maintain adequate oxygen levels. Without monitoring and skilled assessment, those warning signs can be missed. Infection is another major risk for newborns, particularly in the first hours and days after birth. A baby's immune system is immature, and infections can progress incredibly fast. What starts as mild temperature instability or feeding difficulty can become life-threatening sepsis in a short period of time. Early recognition and antibiotics save lives, but only if someone knows what to look for and has the ability to act. Doctors also worry about undetected birth injuries. Things like bleeding in the brain, nerve damage, or internal injury may not be immediately apparent, especially if there's no trained exam after birth. These conditions aren't caused by lack of love or intention. They're part of the inherent risk of birth, and they require medical evaluation to identify and treat. One of the hardest parts of this conversation is that parents choosing free birth deeply care about their babies. This isn't about neglect, it's about capacity. Love doesn't replace oxygen, calm doesn't replace ventilation, intuition doesn't replace resuscitation training. Doctors aren't saying every baby needs aggressive medical intervention. They're saying every baby deserves someone present who knows when intervention is necessary and can provide it immediately. Newborn emergencies don't come with warning labels, and by the time it's clear something is wrong, the window for preventing harm may already be closing. This is why pediatricians, obstetricians, and neonatologists speak up so strongly about newborn safety. Not because birth outside the hospital is inherently bad, but because birth without skilled newborn care removes a critical layer of protection during the most vulnerable moments of a human life. The goal isn't to create fear, it's to respect reality. Babies transition to the world in extraordinary ways, but sometimes they need help. And when they do, having the right help there matters more than anything else. Another major reason doctors are warning women about free birth isn't just the absence of medical care, it's the culture that often surrounds it. Specifically, the way real, life-threatening risks can be minimized, reframed, or dismissed entirely. In many online spaces, free birth is presented not simply as an option, but as a superior or more enlightened way to give birth. Language matters here. Phrases like, "your body was made for this," "fear is what causes complications," or "intervention is trauma" sound empowering on the surface. But they carry an unspoken message. If something goes wrong, it's because you failed to trust yourself enough. That belief is dangerous. Birth complications are not caused by negative thoughts, lack of preparation, or insufficient belief in the process. They are caused by physiology, anatomy, genetics, and chance. When we pretend otherwise, we turn unpredictable medical events into moral judgments, and that leaves women carrying guilt they do not deserve. Doctors see the aftermath of this thinking. They see patients who delayed seeking help because they were afraid of being seen as weak, fearful, or disloyal to the free birth philosophy. They see people who ignored alarming symptoms because they were told pain is productive, bleeding is cleansing, or distress is just emotional resistance. By the time they arrive for care, the situation is often far more dangerous than it ever needed to be. There is also a troubling pattern of reframing serious outcomes as sacred, meant to happen, or part of a spiritual journey. While people are allowed to find meaning in their experiences, this kind of narrative can silence necessary conversations about preventable harm. When bad outcomes are romanticized or normalized, it becomes harder for others to recognize danger in their own births. Another concern is the deep distrust of all medical professionals that is often encouraged in these spaces. Doctors, nurses, and midwives are portrayed as villains, motivated by control, money, or fear. That framing discourages collaboration and makes emergency transfer feel like failure instead of what it actually is, a responsible, life-saving decision. This kind of thinking doesn't just isolate women during birth, it isolates them afterward. When outcomes aren't what they hoped for, they may feel unable to speak openly about what happened for fear of being blamed or told they didn't try hard enough to manifest a better result. Doctors aren't warning women about free birth because they want to control narratives or dismiss spiritual beliefs. They're speaking up because denying risk doesn't make birth safer. It makes it lonelier and more dangerous. Empowerment should never come with silence. True empowerment includes the freedom to say something feels wrong and be taken seriously. It includes the ability to change course without shame. It includes acknowledging that birth can be beautiful and still be unpredictable, messy, and sometimes dangerous. When a culture tells women that trust alone guarantees safety, it doesn't protect them. It sets them up to feel responsible for outcomes they could never control. And that's why doctors push back. Not against choice, but against narratives that put lives at risk while pretending to offer liberation. Another reason doctors are warning women about free birth is because many people arrive at that decision after being genuinely harmed by the medical system. This part of the conversation deserves care, honesty, and zero dismissal. Birth trauma is real. Being ignored, coerced, talked over, or treated like a problem instead of a person can leave lasting scars. For some women, free birth feels like the only way to stay safe. Doctors acknowledge this reality. In fact, many of the loudest critics of obstetric mistreatment are medical professionals themselves. They agree that too many women, especially women of color, disabled women, and marginalized patients, are not listened to during pregnancy and birth. The system has failed people and it has to do better, but avoiding harmful care is not the same thing as avoiding care entirely. Trauma-informed care is about changing how care is delivered, not removing support when bodies are most vulnerable. Free birth often replaces one extreme with another, trading a system that felt controlling for an experience that offers autonomy but no medical backup. The concern doctors have is that when complications arise, the absence of trained support can turn a survivable emergency into a tragedy. Trauma-informed care means having professionals who explain what's happening, ask for consent, respect boundaries, and partner with the patient. It does not mean leaving someone alone to manage hemorrhage, infection, or fetal distress without help. There's also an emotional weight placed on women who choose free birth that doesn't get talked about enough. When you remove professional support, you don't just remove medical intervention, you remove shared responsibility. If something goes wrong, the burden can feel entirely personal. That isolation can deepen trauma rather than heal it. Doctors see this most clearly in postpartum care. After a difficult or complicated birth, follow-up matters. Screening for infection, monitoring bleeding, checking blood pressure, supporting mental health, and caring for newborn feeding and development are all part of protecting long-term well-being. Free birth often cuts women off from those supports, especially when fear of judgment or retaliation keeps them from re-entering the healthcare system. This is not an argument for blind trust in medicine. It's an argument for better medicine. For providers who listen, respect autonomy, honor birth plans, and treat consent as non-negotiable. For systems that allow people to decline interventions without punishment and still receive compassionate care. Doctors warn against free birth because they don't want women to feel forced into choosing between dignity and safety. That should never be the choice. You should be able to say no to unnecessary interventions and yes to life-saving ones. You should be able to feel heard and protected at the same time. Trauma-informed care doesn't mean doing nothing, it means doing better. And when free birth is chosen as an escape from harm rather than a fully informed preference, doctors worry, not because they don't understand the pain that led there, but because they do. The final reason doctors are warning women about free birth comes down to something that sounds simple but is often misunderstood. Informed choice requires accurate information. Choice is powerful. Autonomy matters. But autonomy without evidence isn't empowerment. It's exposure to risk without understanding the stakes. In many free birth spaces, information is filtered. Medical data is framed as biased or fear-driven, while anecdotal stories are elevated as proof. Positive outcomes are shared widely, negative ones are minimized, reframed, or quietly removed. This creates a distorted sense of safety that doesn't reflect reality. When people only see success stories, risk starts to feel theoretical instead of real. Doctors worry because true informed consent means understanding not just what you hope will happen, but what could happen and what the plan is if it does. That includes knowing which complications are time-sensitive, which symptoms require immediate action, and what emergency care actually looks like. Without that knowledge, decisions aren't fully informed, even if they feel confident. There's also a misunderstanding about what medical warnings are. When doctors talk about risk, they're not predicting failure. They're describing probability. Medicine doesn't deal in guarantees. It deals in ranges and likelihoods. Ignoring data because it feels uncomfortable doesn't make those risks disappear. It just removes your ability to prepare for them. Another concern is that some women are encouraged to make choices based on distrust rather than understanding. They're told doctors will pressure them, shame them, or take control away. And while those things can happen, they are not inevitable, and they are not the whole picture. Avoiding medical professionals entirely because of potential harm can mean missing out on care that could save a life. Doctors also emphasize the importance of having a clear emergency plan. Informed choice includes knowing how long it would take to reach a hospital, what resources are available during transport, and who is responsible for making decisions if the birthing person becomes incapacitated. These are not pessimistic questions, they are responsible ones. Without accurate information, women may believe they are rejecting unnecessary intervention, when in reality they are also rejecting options they would want in an emergency. That loss of choice doesn't happen at the start of labor. It happens in the moment when there is no time to decide. Doctors aren't warning women because they believe women can't understand complex information. They're warning women because misinformation thrives where trust has been broken, and rebuilding that trust requires honesty, not ideology. True empowerment means being told the whole story. It means knowing the benefits and risks of every option, including free birth. It means understanding that declining routine care does not remove the possibility of emergency care and planning accordingly. Choice is not about proving strength, spirituality, or independence. It's about making decisions that align with your values while protecting your life and your baby's life. Doctors speak up about free birth not to take choice away, but to make sure that choice is real, informed, and supported by truth. Women deserve autonomy, respect, safety. Honest information. Doctors speaking up about free birth aren't trying to control birth. They're trying to protect lives while still honoring choice. You don't have to choose fear. You don't have to choose blind trust. You deserve evidence, compassion, and support all at the same time. Thank you.